All right, I will now take this time essentially to begin the process of discussing our ASHP ABHP Leadership Award. I'm very honored and excited to be able to participate in this historic event in the relationship between two key national organizations interested in recognizing an individual who's demonstrated exceptional leadership in efforts to reduce racial and ethnic disparities in healthcare. As you know, the relationship between ABHP and ASHP in this annual luncheon began more than 30 years ago, as Dr. Clark alluded. In June 2004, the relationship between ABHP and ASHP began to change when the then President, Dan Ashby, invited and introduced the ABHP Executive Committee at the ASHP Board of Directors meetings for the first time ever. At that time, ABHP had drafted a list of opportunities that the two organizations should address as it relates to health disparities. Those opportunities were passed on to the ASHP staff. One of the items in the 2004 statement recommended that we work to foster leadership, research, collaboration, and also to improve health status and quality of life of minority patient populations, and that we recognize and support those pharmacists that have initiatives that address issues related to meeting pharmaceutical and healthcare needs of minority patients. Approximately 1.5 years later, at the December 2005 ABHP annual luncheon, we began to formally signify our shared desire to more closely align our organizations and work together on issues of mutual concern and interest. The formality of the relationship, including the signing of an MOU, a memorandum of understanding, and exists between ABHP and ASHP even to today. The MOU has led to the formation of the ABHP-ASHP Joint Committee, which is charged with facilitating ongoing communications between the two organizations, evaluating collaborative activities, and also making recommendations to both organizations' boards and also to their leadership. Essentially in 2008, the Joint Committee decided to establish the ASHP-ABHP Joint Leadership Award. At this January 2009 meeting, just earlier this year, the award criteria were drafted and later approved by each organization's board of directors. This award that we present today is an excellent reminder of our ongoing commitment to work together on issues of mutual concern. To the ASHP officers and staff, I extend to you my utmost gratitude for your support and for your contributions to this award. To the ABHP-ASHP Joint Committee members, I commend you for your hard work in strengthening the relationship between ASHP and ABHP. Education and experience alone can't make us all leaders, but they can teach us which leader to follow. To our award recipient, you are a front runner who has given us someone to follow. It is with sincere respect and deep affection that I extend to you our greatest appreciation for your sustained and significant contributions, addressing health disparities and helping us to realize our mission and vision. Thank you. Next, we will have ASHP President.
Well, as I said earlier, I am very pleased to represent ASHP as we join to bestow the first ever American Society of Health System Pharmacists and an Association of Black Health System Pharmacists Joint Leadership Award. And Ernest did a great job describing the award in that it recognizes an individual who has demonstrated exceptional leadership efforts to reduce racial and ethnic disparities in healthcare. This inaugural award winner of the ASHP-ABHP Joint Leadership Award is Dr. Folakemi Odedina. And I had a few moments to talk with Dr. Odedina about her research, which in itself is incredibly impressive, but what really struck me is the connection that she has made between her research and the community that she's worked with, and what effect that will have with Black men and hopefully reducing prostate cancer. Just one piece of the research she's conducted. So let me describe her accomplishments. Dr. Odedina is professor and director of research at the Florida A&M University School of Allied Health Sciences in Tallahassee, Florida. She's currently a visiting professor in health outcomes and behaviors at the H. Lee Moffitt Cancer Center and Research Institute in Tampa, Florida. Dr. Odedina has conducted extensive research on economic and behavioral aspects of the medication use process involving patient care, pharmacy practice, and pharmaceutical economics. And in addition, she has made noteworthy contributions in the area of prostate cancer prevention in African American males, factors influencing minority participation in clinical trials, and pharmacy-based childhood immunizations. As a 2006-2007 Fulbright scholar, Dr. Odedina conducted Nigeria's first ever national research assessing how Nigerians report cancer data. She also developed the National Drug Information Center, created a free newsletter for the country's pharmacists, and introduced National Cancer Awareness Month. She's a very, very busy woman. These are just a few examples of the exceptional work done by Dr. Odedina. Please join me in congratulating Dr. Folakemi Odedina.